Hi, my name is Reem Boudali. I'm a fourth year peer mentor in the general lab, and today we're going to go over the transfers OSCE. So today we're going to talk about two different techniques. One, where we're placing the wheelchair at the foot of the bed, facing the head of the bed at a 45-degree angle, and the second will be placing the wheelchair at the head of the bed at a 45-degree angle facing the foot of the bed. Both techniques are correct, just go by whatever your lab instructor taught in your lab for your OSCE. Some things to take into consider with transfers is that we always want to check the orders, and we want to check the patient's chart as well. We want to get an understanding of why the patient is in the hospital and what kind of conditions may affect them being transferred from a bed to a chair. So the orders are important because there may be oxygen therapy or IV therapy ordered that could infringe on us transferring. So if I am trying to transfer the patient and I'm trying to move and they're connected to oxygen, it could wrap around or it could get stuck and tangled, and it could cause the patient to choke, or it may cut off the supply, which may cause them to go short of breath. So we want to take those things into consideration. In terms of oxygen, we can always get tubing extension to extend the tubing so it doesn't get in the way. If it's an IV running, we can check to see if it has to be continuous infusion or if we can stop it temporarily and disconnect. That way there's no wires in the way to get pulled or cause any pain. So we're going to begin by entering the patient's room. So we're going to do hand hygiene outside the room, enter the patient's room, and grab the curtain or close the door. For the purposes of this video, I'm not going to do that, just so you're able to see what I'm doing. And then once I've touched the curtain or closed the door, I want to make sure that I redo my hand hygiene because I've contaminated my hands. While I do that, I'm going to introduce myself to the patient. Hi, my name is Reem Boudali. I'm a fourth year student at the University of Windsor, and I'm here to transfer you from your bed to your chair. I go by she, her pronouns as well.
Again, they keep on moving me.
I know it can be frustrating to move from the bed to the chair constantly, but it's important that we get you up because physio is going to be here later to help you ambulate. And the ambulation is super important because you are still recovering, and ambulation helps ease that process. If you stay in bed too long, we worry about things like pneumonia or deconditioning, where your muscles kind of get used to staying in bed, and then it's harder for you to get back to your normal.
Oh.
Does that make sense?
Yes, it does.
Perfect. So are you okay with me moving you from the bed to the chair?
Yeah, I guess.
Awesome. Before we proceed, is it okay if I just get your first and last name?
Crisscross.
Perfect. And your date of birth?
1/4/59.
What pronouns do you go by?
He, him.
Awesome. Is it okay if I call you Chris today?
Yes, that's fine.
All right, thank you. So Chris, I read in your chart that you have a cast on your right leg. Is that correct?
Yep.
Okay, is it okay if I take a look?
Go right ahead.
So my first step is that I'm going to move the blankets out of the way. I'm going to put them to the foot of the bed. That way when I'm moving the patient, their foot doesn't get stuck on it. All right, and now that I've confirmed that my injured or weak leg is the right leg, I want to make sure that my wheelchair is going to go on the opposite side. So if it's the right leg, it's going to go on this side. If it's the left leg, it's going to go on that side. All right, so I'm going to grab my wheelchair. I'm going to position it. Make sure the brakes are locked and the footrests are either way. I also want to make sure that my bed itself is locked. So if I came into the room and it was very narrow and there was enough room for me to move my wheelchair, I might turn off the brakes and move my bed, maybe at a 45-degree angle, to allow me space to put the wheelchair. Once that's done, I want to make sure that the brakes are set, because if the patient goes to stand up and the brakes are not set, the bed could move out of the way and the patient could slip and fall. So once that's set, I'm going to move the head of the bed to 30 degrees. If you're unable to estimate, you can also take a peek at the bottom where it has how high the bed is. I also want to make sure that I'm dropping the foot because the foot sometimes automatically comes up when you're moving the head. Alrighty. And I'm just going to move the height of the bed to my waist so that it's at a good angle for me and I'm not straining my back as I turn the patient. So that's a good level. I don't want to place it too high where it's at a risk for the patient. I'm also going to make sure that I'm moving the level of the bed back down once I have completed what I have to do. Right, then I'm going to move the arm side rail out of the way. And now that I'm next to the patient, I'm acting as that side rail. So if I have to move for whatever reason or leave the room or leave the patient's side, I want to make sure that I'm putting that arm rail back up and I'm moving the bed to the lowest position for the patient's safety. So I'm going to go ahead and move the patient onto their side. I recommend using the bed pad as assistance. You can alternatively just grab onto the patient, but the bed pad does help. If the patient is able to help, sometimes bending their knees can help. You can tell them to give themselves a hug, and then just turn them onto their side. Remember, you are preventing them from falling, so you want to make sure that you don't leave their side and you're holding on to them. Great. At this point, I'm going to lower the bed just slightly because I'm going to be bending my knees as I'm swinging the patient up. So I want to make sure that my arm is underneath the shoulder and my other arm is over the thighs. And I want to bend the legs slightly because my wheelchair is at the foot of the bed. As I'm swinging, there's potential that the patient's legs are going to swing into the wheelchair. Now, we want to take that into consideration when we're placing the wheelchair so that that doesn't happen, but sometimes there is no way to prevent that. So we can try and ask the patient if they do have control of their legs to maybe bend or to dodge the wheelchair, but we want to take that into consideration because the patient may not always be able to do that. Bear in mind that this is a mannequin, so it's very stiff and I cannot ask that, so you may witness that I struggle a bit as I'm trying to move the patient up. That typically wouldn't happen with a real person that I'm transferring. Okay. So I'm going to make sure that I'm bending and I'm keeping my back straight. I'm underneath and I'm going to swing up on 3. 1, 2, 3. Alright. So now I'm going to make sure that the patient's legs are on the ground. So I'm going to move the level of the bed down. At this point, I want to make sure that the patient is not dizzy. If they feel very dizzy or they're getting wobbly, I might lay them back down just to regain that. Sometimes it's because of a change in blood pressure that they can get really dizzy, and we don't want to proceed because then they could just topple right over if we try and bring them up. So once I confirm that they're not dizzy, I can leave them and grab their non-skid footwear. Again, because this is the mannequin, I can't really let go or else he's going to fall down. So we're going to pretend that I've placed the non-skid footwear on his feet. Then I'm going to ask the patient to shimmy up a bit. That way they're able to move their legs back and I'm not lifting as much. They're able to more so stand up. So if my patient's feet are extended out, when I go to lift them up, I have to fight all of the weight of their upper and lower body. It's almost like they're on a diagonal. But if I have them move their weaker leg back and their stronger front in front, but also behind so that their knees are sort of bent, all I have to do is when I'm lifting them up, just get their knees to be fully straight. And I'm not having to fight as much of their upper body as if their legs are extended out. I'm essentially only lifting their lower body. If I'm too close to the wheelchair or I'm too far, I might ask them to shimmy to the side if they're able to. Then I'm going to instruct the patient that I'm going to place my hands on their waist. If they have an Attends on, I might grab onto that for extra support. And I'm going to tell them that I'm going to swing them back and forth and that we're going to stand up on 3. I want to make sure that their weak foot is in the back, so in this case it's the right foot, and that their strong foot is in front. I personally like to make sure that my legs are in between their legs, so if they do get up and they're wobbly or they try and fall, my leg is there as a support. I'm placing a foot behind me so that I'm able to pivot afterwards and place the patient directly into the wheelchair. All right. So Chris, we're going to rock back and forth, and on 3, we're going to lift you up. If you're able to, put your arms on the bed, and I'm going to have you push off with your arms and stand up on 3, okay? Ready? 1, 2, 3. So now I have the patient standing up, and what I'm going to do is I'm going to pivot with my back leg so that they're facing the chair. I want to make sure that the patient is not stepping or jumping back to reach the chair. We are just pivoting, because remember, they can only weight bear on 1 foot. So Chris, I'm going to have you place your arms behind you until you can feel the arms of the chair, and then I'm going to have you slowly set yourself down when you can do so. And again, because I'm holding the mannequin, I'm going to do this for him. So once the patient is in the chair, so once they feel the back armrest, they're going to slowly lift themselves in the chair. And then you want to make sure their back and their bum is fully to the back of the chair. So Chris, are you able to shimmy back for me? Perfect. I want to make sure that he's not leaning to side. We want to make sure that he has proper alignment, so his head is in line with his shoulders, which is in line with his hips. And then I'm going to see if there is any seatbelt. I want to make sure that I'm clipping him in. And then I can move the chair at this point. That way I'm able to move the footrests back. And then I'll ask the patient if they want a blanket. Chris, would you like a blanket to go over you? All right, perfect. And I will just drape that on top. And then the patient maybe want to be repositioned if they want to watch TV or face a window. I want to make sure that if I'm leaving the room, I am setting the brakes. And that the call bell is within reach. So I grab the call bell, put it in the patient's lap. All right, Chris, you're all set to go. Do you have any questions at all?
No, no questions.
So I think physio is going to be here in about an hour, but I will call them to let them know you're up in the chair.
Okay.
All right, make sure that you click your call bell if you need anything at all, and I will be back after physio is here.
Okay.
All right, take care.
Bye.
So now we're going to go over how to do that with the wheelchair at the head of the bed. The procedure going up to that point is still the same. We're just going to make sure that when we're setting up the wheelchair, it's at the head of the bed, facing at a 45-degree angle. Again, the patient is going to get up, and they're going to pivot to the chair. So we want to make sure that we're placing it in a position where it's not too far where they have to get up and pivot all the way back, but one where they can just get up, pivot, and the chair is right there. So I'm going to go ahead and turn my patient onto the side. I'm just going to raise the level of the bed slightly so that I'm not straining my back. I'm going to bend the patient's legs to make it easier for me, and then I'm going to grab onto the bed pad and turn the patient right onto their side. Again, I'm going to place one hand on the thigh and then one hand underneath the shoulder, and on 3, I'm going to swing and I'm going to shift my weight to the back leg. So ready? 1, 2, 3. Alrighty. So my patient is sitting. I'm going to lower the level of the bed so that the patient's feet are touching the floor. And then I'm going to place my non-skid footwear after I've made sure that the patient is not dizzy and they're not going to fall over. So again, because I'm holding the mannequin, I'm not going to do that, but I would place it on the left foot specifically because they have the cast which has non-skid on the bottom. All right, once that's all set, I'm going to have the patient shimmy forward to the edge of the bed as much as they can, place their hands on the foot. I'm going to make sure that I'm positioning myself in between their legs in a way where they're able to pivot. So like so. And this is providing support. All right, Chris, I'm going to rock you back and forth. On the count of 3, I want you to push off the bed with all the strength that you can, all right? I want to make sure that his weak foot is in the back, his strong foot's on the front, and that's going to help facilitate him standing up in an easier manner. All right, ready? 1, 2, 3. All right, now we're going to pivot. So I'm going to pivot my back foot, pivot, and then I'm going to say, Chris, when you feel the back of the chair, when you feel the chair at the back of your legs, just reach down behind you until you can feel the armrests. So once you feel the armrest, just slowly let yourself into the chair. And I want you to scoot all the way until your back hits the back of the chair. So now he is in the chair. If there is a seatbelt, I'm going to lock him in. Alrighty. And then I'm going to move the footrests into place. And then I want to make sure I'm resetting the brakes before I leave. The call bell has to go with the patient, and then I'm going to do hand hygiene before I leave. Again, I want to let the patient know that physio is on their way, and make sure that the call bell is with them before I leave. All right, Chris, you're all set and ready to go. Would you like a blanket? Here you go. Physio should be back soon, so they should come and help you get back into your chair, and you can remain in your chair to eat your dinner, and afterwards, if you want to head to bed, we'll help move you back into the bed. Does that sound okay? All right, perfect. Take care, Chris.